that never stops moving, true health is about finding your balance. Welcome to Wellness is Wealth. Join us as we explore the connection between mind, body, and spirit. From nourishing nutrition to mindful living, we're here to help you slow down, breathe, and heal from inside out. Let's find your wellness together. I'm your host, Pier Pastor.
And I'm Dr. Gina Nazareth, your co-host for the week. We're cutting through the noise to bring you actionable health advice, cutting-edge wellness trends, and the inspiration you need to own your well-being. Your journey to a healthier, happier you starts right now.
Good morning, wellness investors. You are watching
Wellness is Wealth.
Wellness is wealth. Wellness is wealth. Wellness is wealth.
How many of you have been dealing with nonstop runny nose lately? Well, it turns out we just commemorated National Allergy Day last July 8th, and the latest local research shows that allergies are officially a nationwide battle. Thanks to our tropical, humid weather and all the pollution in our growing cities, respiratory allergies are absolutely skyrocketing. 2 out of every 10 Filipino adults are living with allergic rhinitis, and it's hitting our children even harder.
And because the Philippines is highly humid, the local allergen profile differs from temperate Western countries. House dust mites are the #1 indoor allergen, affecting up to 74 to 85% of allergic patients tested. Asthma is by far the most dominant manifestation, which is around 74.9%, followed by atopic dermatitis or eczema, 13.2%, and allergic contact dermatitis, 7.9%. Food allergies are increasingly referred to by local immunologists as the second wave of the allergy epidemic following the initial rise of respiratory cases. In fact, up to a nearly third of kids in certain age groups are suffering, giving the Philippines some of the highest pediatric allergy rates in Southeast Asia. It is definitely time to start talking about real solutions. Behind the diagnosis, let's meet Tender Caryaga. She never enjoyed this seafood that smells so good with butter and garlic, the shrimps. And because of the scare it brings every time, she attempts to enjoy it.
Tender Caryaga was just 2 years old when she realized she is allergic to shrimps. Her dad made sinigang na hipon that day, then 1 sip of that soup.
Nagtanong ako kay dad, sabi ko, ba't parang ang kate ng lalamunan ko talaga sa loob, iba?
There was allergic reaction even to the broth of the shrimp, which started with an itchy throat that became a scary episode of difficulty in breathing.
After nun, sobrang kate, tapos nahirapan pa akong huminga. Parang hinihika na po yung pakaramdam ko nun. Yung parang allergy sa loob ng lalamunan mo tumutubo, yung ganun po yung pakaramdam ko.
Tender remembered that during that time she was given a spoon of sugar and other sweets as remedy for that allergy attack, and she got better. For some time, Tender thought she will outgrow the allergy like other people. In her mind, maybe the shrimp that caused the allergic reaction wasn't clean or fresh. But even if she eats fresh ones, she gets the symptom.
Sinusubukan ko po siya na baka sakali kasi naririnig ko din na sinasabi nila na pagka tinry mo ng trinay, mawawala. Kasi may mga friend din po ako na parang kasabay ng mga allergy pero ngayon nakakakain na sila eh. Sabi ni inuman nila ng gamot, sa akin hindi po talaga umubra eh. Okay lang naman po sana ko yung allergy, parang makagat ng lamok. Di ba may ganong allergy? Okay lang po sana yung ganon. Kaso yung sa akin po, hindi ako nakakahinga kaya parang medyo nakakatakot po.
Tender kept trying for a while. She liked bagoong.
Kasing kamas, basta may bagong, ang sarap niyang kainin. Tapos after nun, ayun na, parang nahihirapan na akong huminga. Tapos kailangan ko na po mag-water, inom ng gamot, tapos matamis.
But even shrimp-flavored cup noodles and shrimp-powdered chips or snacks make her sick.
Hindi po nga po ako marunong magbalat ng shrimp. Kasi hindi po ako kumakain talaga.
Then Tender finally stopped trying to overcome the allergy and never ate shrimps ever again. For her,
The enjoyment in eating shrimps is not worth the scare you feel, knowing that the next allergy attack could be a dangerous one.
So even daw, Doc, yung mga chips.
Yes, kasi may extract siya, kaya yun yung nakakapag, allergy. Oo.
Yes,
The
the
shrimp
proteins
extract,
from
the
the
proteins,
shrimp
yes.
proteins.
All right. Now, to give us the expert perspective on what's really going on, gracing our show this morning is Dr. Marysia Recto. Dr. Recto is the head of the Allergy and Immunology Section of the Department of Pediatrics at the Asian Hospital and Medical Center. Good morning, Doc. Welcome to Wellness is Wealth Billionaire News Channel.
Good morning, Pierre. Good morning, Dr. Gina. It's a pleasure to be here.
All right, Doc. Yun na, Doc, itatanong ko na agad yung binabaliwala kasi ng Filipino at itong allergy. Kasi allergy lang naman yan or parang kala nila nangangati lang. So why do we have to give importance, Doc, to this particular problem?
Well, allergy has actually often been downplayed because they may appear mild.
Yes.
But allergy is basically a imbalance in the immune system when it's too active, very sensitive to environmental factors, and sometimes even internal factors. So it has been shown in allergy that maybe the first exposure will not cause a very severe reaction, but because it continues, no, and there's a gradual, what we call sensitization, the reaction can become quite severe. And allergies are not only limited to one organ. Allergy is what we call a systemic condition wherein all organs can potentially be activated once or flared up during an allergic reaction, ranging from the skin to the lungs to the gastrointestinal tract, even the cardiovascular system, and even the nervous system.
Pero bakit nagkaka-allergy? Oo.
Well, why do we get allergies? It's actually an interplay between the genes of a person and the environment they live in, or what they're exposed to, even sometimes how they are brought up. So you can have that genetic tendency, and then you get exposed to a certain allergen. So we're not allergic to everything. It depends upon a certain exposure at a certain person, and then that's when the allergy will come out, and not in the first intake, no, as time goes by. Now, some patients actually develop what we call epigenetics. Sometimes you don't even have a family history. And that's why some are perplexed. Why do I have asthma? It's not in our family. Why do I have this allergy? Wala naman sa aming ganito. Well, it has been shown that our current living conditions, like the lifestyle, the food we eat, the exposure to toxins, to pollutants, to irritants, to climate change, all of these actually can bring out an allergic tendency in a gene, in a person who has no genetic tendency.
And probably the additives, mga bago, Doc,
Yes,
just to
oo.
preserve their makeup, preserve your skin products.
Yes. So, that's the modern lifestyle. We call the westernized lifestyle has changed or increased our tendency to develop allergies. That's why allergy is called an epidemic now.
What are the usual triggers ng mga yung allergy?
Okay, so we are all familiar with food. We always think that food is a trigger of any allergy, but we also have to consider there are also what we call airborne allergens, no? These are from
Nakukuha sa hangin.
yes, so pollen, dust mites. Dust mites are number one. Then we have animals, no? The animal danders, cat, dogs, even hamsters, even some people who have rabbits in their house, they can develop sensitivity, and medications, no? You can actually have triggers these are what we call external triggers, but they're also internal triggers. And these internal triggers are stress, which a lot of us are facing now with the modern lifestyles, and also hormonal changes. So these are things that can also bring out allergy.
What are the usual manifestations kung stress yan, di ba? Ano yung usual manifestations niya?
Well, since allergy, as I mentioned, is systemic, it can range from skin problems like hives, or what we call urticaria, even flaring up their eczema can be triggered by stress. Also asthma, no? It's also triggered by stress. Some people have what we call stress-induced allergies.
Alright.
Sometimes they also have, but rarely the severe allergies. Mostly it's chronic and persistent that affects their lifestyle.
Doc, meron lang akong isisingit. Kasi kanina yung banggit na hindi lang siya sa ilong. So, ibig ko sabihin, Doc, kunyari, nabahing ako, anong connection nun sa ibang parts of the body that becomes systemic already?
Okay, so allergic rhinitis is the most common allergy. It affects almost 2/3 of the world's population. That's how many people with allergic rhinitis are. And once you start with the respiratory allergy, that is connected, the nose is connected to the lungs. It is also connected to the eyes, to the sinuses, to the ears. And they actually saw that allergy is all over, even the brain, no? Even the skin can get affected and the gastrointestinal tract. So we have many patients who have allergies who even have mental health disorders, no? Because of what we call the inflammatory state.
Pero yung ano yung pangangate, balik tayo doon, yung pangangate, namumutla, namamantal, namamaga. Bakit nangyayari yun?
Namumula po.
Oo.
Okay, so the allergic reaction occurs because of a certain product that is produced by our allergic cells called the mast cell that gets activated. And this product that is released is histamine.
Alright,
So
alright.
histamine can go into our bloodstream and cause all these symptoms of redness,
Okay.
pamamaga, congestion in the nose or in the lungs, you know, closure of the lungs, yung tinatawag na spasms, and also itching of the eyes. No? So those are the cardinal symptoms of allergic inflammation caused by histamine.
Alright.
Yeah.
Okay. Doc, meron lang akong isa pang question. Yung pong types of allergy, di ba you mentioned already, airborne, and then merong ano pa po ba yun? Ibanggitin lang natin na mabilis.
Okay, so depends on the organ affected, no? So you can have the skin allergies, you can have respiratory allergies, which includes rhinitis, even the conjunctivitis of the eyes and the lungs, no? And then you can even have gastrointestinal allergies, no? Manifesting with vomiting, etc. And usually you could see that there are triggers that can affect all these organs. So, like for example, a food allergen usually will attack the skin and the gastrointestinal tract. But airborne allergens can affect the respiratory tract usually, but also the skin. So, yung skin allergy has many triggers.
Alright.
So, that's respiratory allergy. So, yun yung difference.
Okay, natanong na po natin ito kanina. So, atopic dermatitis triggered by allergens are, ano po yun, dati na siyang may atopic dermatitis, tapos natitrigger po siya, lumalala. Ano
Yes.
po? Yeah, okay.
So you have the genes, you have the tendency, and then atopic dermatitis is actually what we call the start of the allergic march, no? What is that? When the infant gets the first allergies, usually in the skin, and they call it atopic dermatitis. But as the child gets older, this one can change, meaning that the allergic atopic dermatitis can become more controlled or lesser, and then the respiratory allergies come out.
So hindi siya na-outgrow talaga?
There's no such thing kasi as outgrowing. Kaya some people will say na-outgrow ko na yan, but I'll tell you them, one day it will come back.
I see.
Okay, and we don't know when that will happen. So, if you have that atopic dermatitis, you can get triggered, no, by external allergens and even internal, meaning like it's not really an allergy, but it's an immune reaction that gets hyperactivated.
Okay.
So that causes what we call the flare of atopic dermatitis.
Stress.
Stress or
hormones?
maybe it could be food. Like in children, the most common trigger for atopic dermatitis is food.
Yeah, food.
And also infections.
Alright.
Now,
Yeah,
sometimes we think,
yes.
bakit-
Viral.
yeah, viral can, because your immune system is trying to fight the virus, it can activate your allergy as well because the allergy system is really part of your immune system.
Based on experience, stress triggers my itch in the scalp.
Yes.
Tama ba, Doc?
Yes,
Stress
it
yun.
can be.
All
Yes.
right. Now, Doc, who are prone to have allergies and what is the severe allergy that a person could experience? You will answer this after a short break. Keep it here on the Billionaire News Channel. Wellness is Wealth.
Wellness is wealth. That's the richest thing. I can hold myself. Wellness is wealth. That's the richest thing. I can hold myself.
Allergies can affect more than just our nose, eyes, or skin. They can interrupt sleep, drain our energy, and keep us from enjoying everyday life. For our Wellness in Motion this Sunday morning, let's elevate a moderate low-impact practice with a sling and do aerial yoga to help ease allergy symptoms.
Graceful yet invigorating, this dynamic wellness practice allows one to move with greater freedom while improving flexibility, building strength, and enhancing balance.
Aerial yoga is an evolution of the traditional yoga practice, and it uses a suspended hammock to support the body in movement, in stretching, and in inversions.
The hammock is a tool that allows one to move through a series of poses, stretches, and flowing transitions to help deepen movements and reduce pressure on the joints. Teacher Macy explains that aerial yoga works with gravity, allowing the body to feel lighter while promoting gentle spinal decompression. But the hammock does more than provide support. It also challenges the body to stabilize, engage, and stay in control. With every sequence, participants develop functional strength while improving balance, coordination, and body awareness.
Grip is very important, grip strength. Our sequences here is geared towards developing their arm strength, grip strength, because it is one of the indicators of longevity. Strength, especially on their hamstring, the anti-gravity muscle, which is very important to build among those who are already in their adult stage.
For Shirley, 58 years old, who has been living with age-related pain, practicing aerial yoga made everyday movements easier and more comfortable.
I used to struggle going down the stairs. I would only use one foot at a time. But now I can walk down the stairs using both my feet.
Aside from flexibility and balance, aerial yoga promotes relaxation by combining movement, breathing, and mindfulness. Whether you're a beginner or an experienced yogi, it offers a low-impact way to exercise the body and quiet the mind.
Our goal is to lead the students to movement meditation, not just the result or the main posture, but the process itself, moving with the breath, moving with a still mind. Our focus more is doing the postures with a relaxed body, relaxed state of the mind.
With each session, even the simplest poses can become full body workouts. One of the most anticipated moments is the inversion, hanging upside down.
Ideally, the practitioner should wear light clothing, not too loose, so that when they do inversion, hindi matatakpan yung face nila. And they will be very comfortable exploring inversion poses, but not too tight so that they can breathe properly.
Aside from relieving pressure on the spine, aerial yoga gives the body a chance to lengthen and reset. For many participants, it's a moment of liberation, learning to trust their body, overcome feelings of anxiety, and embrace movement from a different point of view.
Practicing aerial yoga or yoga helped me mentally. It gives me clarity, it gives me peace.
It helps me boost my confidence, and it helps me understand the different challenges that other people have.
Aerial yoga for them offers a unique path to stronger body and a calmer mind, because sometimes the best way to feel grounded is to spend a little time in the air.
Doc, can exercise really help in kapag may allergy ka?
Well, if you have asthma, syempre, it's part of the exercise for the lungs, no, the breathing in. But it all depends also on the exercise that you do.
Okay.
Now, there are some patients, though, that are triggered by exercise. Their exercise-induced asthma comes out, no? And what we do...
Pag sobrang
Yeah,
pagod.
because they
kasi
kind to bypass the nose
I see.
and breathe through their mouth. So when you do that, the humidification process is parang hindi dumadaan sa nose, no? So they start having dryness, and then they start coughing, and then they cannot breathe. So you can still exercise naman, but you have to take some medication.
Before.
Probably before. No?
And
We
choose
call-
the exercises na lang siguro, Doc. Maybe low
Yes.
impact like yung yoga can help.
Yoga is good because you breathe regular breathing. They teach you how to breathe, and also swimming. No, swimming is actually very good unless
But
you have.
non-chlorine.
Yes, if you have eczema, it can trigger the eczema.
Okay. Now, still with us is Dr. Recto. Doc, going back to our hanging question, sino-sino po ang prone to allergies? Ito ba ay lahi? Ito ba ay may edad? Or mas marami ba ang babae kaysa sa lalaki? Or bata kaysa sa matanda?
Okay, so it's usually a genetic phenomenon, no? Parang may genes kayo, but as I mentioned earlier, you don't have to have the genes. It's also the kind of environment we're living in, the environment we're raising our children in, no? Sometimes they said even the mother may not have the allergy, but because of what she ate during pregnancy, the exposures, let's say, to smoking, etc., that can actually make that child a kind of allergic kahit na walang genetics, no? And then the age group, walang pinipili. From the newborn to geriatrics. That's why the practice of allergy is what we call adult to child to adult, no? Because the kind of allergies are the same. They don't outgrow. They're just persistent.
Okay.
Now, whether it's more children and adults, we see more adults with allergies because the sensitization, the development of allergy takes time. So pagdating na ng adulthood, dun talaga yung maximum.
When you say sensitization, ano ibig sabihin nun?
Okay, so
Sensitive ba ang root word?
it's actually
Sensitize?
yeah, it's a process, an immunologic process that happens in our body when we react to a certain allergen. So in the beginning, you are just developing what we call IgE antibodies to that allergen. Wala pang nangyayari sa'yo. So nandyan lang siya floating in your system on the allergy cell.
Okay.
It will attach there. And then one day, we don't know when, it will just break through. You get exposed to that allergen again, and then dun siya lalabas. So in the beginning, parang you can tolerate that allergen.
Okay.
But one day,
Pabahing-bahing lang.
yeah, or no, or even nothing.
Okay.
And then one day, babahing-bahing ka na. And that's because you develop sensitization, meaning and then when you get exposed again to that allergen, then your allergy cells activate and the histamine comes out. So what we want to do, sana prevent the sensitization, but that's quite difficult now, no, with our environment.
Okay.
Kaya what we do is we deal na lang with the aftermath, which is basically yung
effect.
treat na lang the allergy.
O yun nga, Doc, kapag may allergy ka na, maraming gustong magtanong nito, na-outgrow mo ba siya? Like, kunyari, allergic ka ngayon sa hipon, pwede mo ba siyang mawala pag tumanda ka na or kumain ka ng madami?
Okay, technically, the allergic tendency you cannot outgrow, okay, because it's in your genes already. Now, the kind of allergy, like food allergies, there are certain food allergies that can be outgrown, and there are those that last for life.
Okay.
So yung nagla-last for life, usually shrimp and peanuts, no, or yung mga crustaceans, like even crab,
yes.
lobster, kuratsa, mga ganyan.
Yun ang
Magkapamilya
masarap.
yan, masarap siya.
Yun ang masarap.
So when patients they get depressed, I cannot eat this anymore, just tell them that there are other things to eat naman, no?
Okay.
So then, but the egg allergies, the milk allergies, and other allergies, they outgrow.
Okay. Na-mention niyo, Doc, yung madi-depress dahil hindi mo na makain. Talaga bang hindi na niya makakain yun ever? Or can they eat
Tikim-tikim.
Tikim-tikim.
Okay.
Hindi kasi maliliit lang, pwede, nagtitrigger na, Doc, di ba?
Well, some patients do that. They say, if I eat a little bit, I'm okay, but when I eat a lot, it's bad.
Okay.
But you're playing with fire. Because one time, that particular sensitization will be so extreme, you cannot breathe anymore, no? Kaya we tell patients, we advise them, you really have to avoid and just shift your preferences, di ba, to something else.
Okay.
Ang very common ngayon sa mga bata, peanut allergy.
Yes.
So before, that wasn't an issue here in the Philippines. We used to eat a lot of peanut but kasi the kind of peanut that's being presented to us now is not usually we boil our peanuts, no? Before, di ba, yung mani.
may balat siya, oo.
Pero ngayon, roasted. That's the one that we have in peanut butter. And they found out the roasted peanuts are more
ones you-
allergenic than boiled.
The process siguro, Doc.
Yes.
Maybe we can eat the natural peanut. but not the processed
Yes.
peanut.
So yun yung kind of allergies that can outgrow. We give them hope naman kasi as allergists, we monitor, no? You can take it already at this time. There are ways by which we do testing to find out in the first place kung talagang allergic talaga. Kasi sometimes we have feeling na ay, nag-rashes yan dahil may kinain. But we have to really justify, is that the case? Because sometimes the parent or the patient itself will stop themselves from eating and their nutrition will suffer.
Yun.
Doc, would you advise skin testing?
Well, syempre, allergist ako. So we will advise it kasi we have to be objective. Some patients will think it's the food. Most of the time, when there's a rash, it's food. Or even when they're coughing, they think it's food. But pala ang trigger, airborne. Or maybe there's stress. So imagine depriving yourself of the yummy shrimp when you're not supposed to. That's why we are testing to give hope to the
Iniwasan mo,
patient.
mas masarap,
hindi
yung pala, hindi
pala.
naman
Oh,
pala siya
kawawa
yun.
naman,
Yes,
di ba?
oo.
So we do the test. It's available we're around 200 allergists in the Philippines, no? Kulang pa rin kami, but you can always also, some of the general practitioners can avail of blood allergy testing, which are done at certain laboratories, just to justify, talaga bang may justification to avoid certain things.
Okay. Doc, meron pang question. Yung bata na pinalaki mo pa ng sobrang malinis, could also, sobrang linis, yung environment niya, siya mismo, ganyan. Pwede pala siyang magka-allergy dahil doon?
Yes, because we have normal microbiota. We call that organisms in our body, in our skin, in our respiratory tract, in our gut, no? And those organisms are very important in modulating the immune system. They are important in training our immune cells. So imagine if you deplete them because you take too much antibiotics, you are cleaning, okay? Or you don't want to eat anything na hindi diverse, you're always eating the same thing. You will not develop those normal organisms, and then you become more prone to developing allergies.
I see.
So that's why they call that the hygiene hypothesis.
Okay.
Meaning, sobrang linis, wala nang microbiome. That's not good.
Wala
That's why in
nang
the COVID pandemic,
panglaban.
it was seen in the COVID pandemic, we were keeping our children away from COVID, keeping them at home, alcohol here, disinfectant there, masking, etc. When these children came out of the pandemic, they became very sickly. And so, bakit sila nagkaganyan? Because masyado silang nawala sa, hindi sila makapunta sa garden kasi walang interactions. So that's why now we have to encourage mothers, no, who have the genetics that they should not be too clean.
Okay.
Hindi naman yung madungis talaga, no? Pero yung exposure to a little dirt.
Pinagulong yung
hindi
anak sa...
naman.
Doc ha, yung di ba during the pandemic, nauso naman yung mga pag-alaga ng mga dogs, di ba? So, nagkaroon ba ng increased incidence of, syempre, di ba, may makukuha ka ring allergy sa mga animals, mga pets, right?
Good question. Marami talaga, no? Before, when we would do our allergy test, ang positive lagi, dust mites and cockroach.
Okay.
But recently, after the pandemic, dust mite, dog and cat.
Dumami.
Si cockroach, buti hindi na alaga, no? So, dog and cat. So,
Niyayakap po kasi yan eh.
yes, but the dogs and the cats are also good as sources of the microbiome. But if you have the sensitivity, which is genetically determined, if you keep your dog in your room, sleeping beside you on the bed, parang on the sofa, kissing and hugging, the saliva, the urine, and the fur of these are very allergenic. So, talagang, it's painful, no? When patients have to be told that they have to keep their animals away from their living area.
Hindi ba pwedeng, kunyari, iinom na lang muna sila ng antihistamine before hugging?
Okay, so yan ang ginagawa ng iba, lalo pa kung allergic sa
Kasi
hipon,
love
iinom ng
laban,
antihistamine.
pets nila.
That's actually, as I said, dangerous. Kasi it's not going to protect you, no? But we have some treatment in allergy called immunotherapy, desensitization. Yung allergen talaga, like the dog hair, ini-inject.
I see.
Or under the tongue, binibigay every day hanggang sa hindi yung injection every day, yung under the tongue every day, but it's what we call allergy shots. and it sort of desensitizes you
In small amounts.
Yeah, so yung talagang super lovang dog, they will go through this kahit na ini-inject.
Parang anak na yung dog.
Oo.
Na, Doc, may next question tayo. Yung isang adult ba, Doc, posibleng magka-allergy, mag-develop ng allergies to something kahit na wala siya nung bata?
Yes, yes, yes.
Dahil yun, Doc, saan?
Because it's, again, depends upon the circumstances of the patient, no? Like in the elderly, they usually get the allergies because of all the medications that they're being given. No, ang dami. Dati, nung bata sila, walang gamot, di ba? Kaya drug allergy in children, meron din, but not as much as adults. Because of what we call polypharmacy, dami. And also, ang tagal na nilang tinetake. And then we see patients developing more respiratory allergies like allergic rhinitis in their middle ages, no? Because they have been exposed constantly compared to the child.
Okay.
So, some patients will tell me, bakit 80 years old na ako, nagka-allergy pa ako? If you have that genetic tendency, it will come out anytime of your life.
Dok, punta naman tayo sa severe form of allergy, yung anaphylactic shock. Ano ba mga manifestations yan? Paano mo malalaman na, naku, eto na, mag-anaphylaxis to, mag-anaphylactic shock to?
Okay, so what is anaphylactic? Anaphylaxis, no? It's a systemic allergic reaction, meaning all the organs are activated by histamine. Parang nag-flare talaga from the lungs to the heart to the gastrointestinal tract to the skin, no? And you would know it if this all occurs simultaneously. And it usually occurs within 5 to 15 minutes after an allergic exposure, no? Sometimes you know the allergen, sometimes you don't know it, no? Kasi first time mangyari. So it's really life-threatening because if the airway, especially the airway closes, no? Usually upper airway, or which is like in the larynx, the throat, or in the lungs. Pag walang air, oxygen tayo more than 15 minutes, the brain can die, no? Brain dead.
15 minutes lang.
15 minutes. That's why you have to reverse it right away because if not, it can potentially lead to death, no? So anaphylaxis is something that not common. Not everybody with allergy will get anaphylaxis, but you can be prone to it. Especially if you're playing with fire. What I'm saying, like, allergic ka na sa hipon,
Try ka pa.
try ka pa kahit na konti because I have patients, hinalikan lang, kumain ng hipon, hinalikan yung bata, nag-anaphylaxis yung bata. No? Or in adults, no? Yung iba nag-kissing.
Hindi, namaga muna, local muna siya.
Yes, local, and then later on, hindi na makahinga. So those are the symptoms, no?
Ano yung makikita namin sa isang pasyente na dapat na siyang itakbo or kami dapat nang tumakbo?
Okay, so kung respiratory, you will see that sneezing, the eyes are swollen, red, and then suddenly they keep on clearing their throat. Or they're coughing and coughing, and then they are, well, syempre, gasping for air. Medyo bad na yun. Nagkakaroon na ng bluish color yung lips,
Kulang sa air, kulang sa oxygen.
Kulang na sa oxygen. Or yung iba, throwing up. They keep on throwing up. No, That's actually part of it. We have a few patients na nagsi-seizures during that time. So, yun yung mga, you know the allergen, may kinain, and then it's happening in front of you.
So, what are we going to do? Kunyari, ano ba yung first aid niyan? O kunyari, nasa bahay kasi. Diba, syempre, tatakbo natin siya sa hospital. Pero sa bahay, may first aid ba yan? Na pwedeng gawin?
Well, if it's the first episode, medyo mahirap, no? Kasi hindi mo anticipate yon. So, some will actually give an antihistamine, no? That's the common thing that's given. It can help, but it's not going to be the best option.
Should just bring the patient to the hospital.
To the ER na. But if you know already, kasi sometimes accidental exposure, no? Yung hindi mo alam na nandun pala sa kinain. So what we have to teach our patients is the use of what we call epinephrine. Okay, this is a life-saving drug that will open the airway immediately, take out the swelling, and even the blood pressure, which can drop. That's why we call it shock, anaphylactic shock. Yun yung bumabagsak na yung BP, the heart rate is going up, you're losing consciousness. Yun nare-reverse ng epinephrine.
Okay.
So yung EpiPen or epinephrine pen, sige nga, you tell us more about it, Doctora.
So the epinephrine or EpiPen is a device that already contains epinephrine at the right dose, either for children or for adults. And it is in a special device that will allow you to inject it even through clothes, no? And usually it's injected in the upper outer thigh which has the fastest absorption. Ang problema natin, wala kasing epinephrine dito sa na EpiPen, no, in the Philippines. We're trying to lobby, our society is trying to lobby for it. Hopefully, we can ask
Natanong na
companies to bring it in. But, what we give our patients is epi-ampule. Okay, these are epinephrine in little vials, no, that we have to break and we have to put a syringe in so that we can inject it. So maraming steps,
Alright.
which is a little tedious but has to be done in order for that patient to live.
Alright, now Doc, bago natin sagutin yung marami pang tanong on how to test it and how do we prevent it, ayan. You will answer that later, Doc. I will have to take a short break. Keep it here on the Billionaire News Channel, Wellness is Well.
Wellness is wealth. That's the richest thing. I can hold myself. Wellness is wealth. That's the richest thing. I can hold myself.
For many people with food allergies, one of the biggest risks in dining out or buying takeout is what they don't know or see. Unknown allergens and cross-contamination can turn one meal into a health concern or even worse, an emergency. On today's Wellness Table, Chef Nathaniel Uy shares simple, practical tips to help reduce your exposure to food allergens, starting with the safest kitchen of all, your own.
The safest meal may be the one you prepare yourself. Cooking at home gives you full control over every ingredient, helping one avoid hidden allergens that can sometimes be found in restaurants, cafeterias, or takeout meals.
Number one is prep your meals. So at least pag naka-prep na yan, hindi ka na ma-force to eat out.
One of the best habits you can develop is meal prepping. According to Chef Nathaniel Uy, it is advisable to set aside time every weekend to prepare meals that can last for 3 to 4 days.
You'll be eating that meal for like the entire week. You can do like 3 days and then 3 days again. So at least shorter.
Of course, food safety should always come first. So before eating any prepared meal, check that it's still fresh and safe to consume. According to USDA Food Safety and Inspection Service, keep meals refrigerated at 4 degrees Celsius or 40 degrees Fahrenheit or lower to help maintain freshness. Chef Nathan says adding a simple kitchen staple to your prep meals can help keep food fresh and extend its shelf life naturally.
To preserve your food, add vinegar to your dishes. So maski hindi yan adobo, you can add a little vinegar, a teaspoon, as much as a tablespoon. If you're cooking like a kilo of meat, it will help the shelf life of your food much longer.
The mild acidity can help preserve the food and keep it fresh longer when stored properly in the refrigerator. With healthy meals already ready and stored properly, you're less likely to order takeout or eat out of convenience, and it makes it easier to stick to food and drinks that are safe for your body. A little planning each week can help you eat with greater confidence while supporting a healthier, more consistent diet.
Pinagkakasya yung oras daw kasi masyado maraming kailangan pag-usapan.
yes.
Pero Doc, how will we know kung saan tayo allergic to? So, what are the tests? Yun po ba talaga yung nire-recommend test? Skin test?
Because, there are many what we call perceived food allergies. Yung inaakala
Akala
na
nila.
allergic ka pala doon, tapos nababawal, which affects your quality of life, no? So, the allergists can do what we call allergy testing. There are 2 forms. One is yung tinatawag na skin test, no? So, we prick the allergens here on the forearm or the upper back. Parang very light pricking. And after 15 minutes, magiging mukha siyang kagat ng lamok or parang like a wheel.
Ibig sabihin?
And then that means that patient is sensitized. Hindi pa siya allergic. So we have to correlate it clinically. Like, kung lalaki yung shot, let's say peanut, lumaki, pag kumain talaga siya ng peanut, lumalaki, nagkaka-reaction, then that's a true positive.
I see.
Okay? Because some people, lalaki yung peanut, pero kinakain nila, wala. Then that doesn't mean they're allergic. Will they develop allergy? Possibly. Okay?
So, kino-correlate pala siya.
Yes, hindi pwede na gagawin ko lang. And then, and
Correlate, how do you do it, Doc?
by asking the patient every time you kiss your dog, magre-react ka ba? Yes, doctora. Then we say, that's a true positive.
Okay.
Now, meron ding blood allergy test, no? We usually do this in patient pag talagang grabe yung allergy, no? Hindi kami makatest, or the patient is on an anti-allergy medication that will suppress the reaction. So yun, may mga certain laboratories that have those. Ang danger kasi, some patients will go to the lab and just do the test, but they do not know how to interpret it, no? So when they misinterpret it, their quality of life gets affected. So let's say, positive nga sa hipon, dun sa test, pero she can eat naman. So we will not stop that patient if they consulted with us. But that patient will get scared and just not take it. So it would really be good na the tests are done in consultation with the doctor.
All right. Now, medicines for allergies, Doc. Yung ating common na iniinom na cetirizine or yung antihistamine. So, how does it work, Doc, para mapigilan yung reaction?
So, as I said, the main mediator that causes the reactions of the swelling, the redness, the itching, and then whatever, sneezing, let's say, is histamine. So, it's just logical. You give an antihistamine against that, no? But sometimes the antihistamine is not sufficient, no? Because it's an inflammatory process, meaning prolonged, chronic, persistent. Kaya yung iba, parang walang symptoms, pero meron pa pang nangyayari sa loob. Like sa ilong, meron pang nangyayari. Sa skin, mukhang normal, but it's still acting. That's why we have to give what we call anti-inflammatory.
Steroids.
Most of the time are steroids, but not the oral. We prioritize what we call topical, meaning for eczema, it will be the topical steroids. For the nose, it's intranasal. For the lungs, it's inhaled.
I see.
So it's not oral.
So kaya yung mga may asthma nag-i-inhale.
Yes, that's what we use for preventive and for control. But if it's really bad, then we have to give the oral steroids, or sometimes ina-admit sila for the IV steroids.
Okay. Ulitin lang natin ng konti, Doc, yung EpiPen. Opo. Ano po ang pang-emergency po ba siya? So, how do you use it po pag ayan na
So, EpiPen is given for anaphylaxis. So remember, anaphylaxis is not just pantal. It has to have a kasamang other symptoms like difficulty breathing or vomiting. Pag meron kang pantal lang, you just give antihistamine. But once there is already respiratory compromise or gastrointestinal, that's when you have to give the epinephrine. Okay, so we inject it, no? If you have the EpiPen, it's a auto-injector, meaning pre-filled na siya, may laman na siya na right dose, and it's injected usually in the upper outer thigh, no, of the patient. Kasi that's the fastest absorption. Kasi dapat mabilis, no? Now, if
even
we don't,
with clothes, no?
wala lang tayong EpiPen.
Even with clothes, yes.
Wala tayong EpiPen dito eh.
I see. So, anong kapalit?
We have what we call epi-ampules. So, if you have, unfortunately, an attack of anaphylaxis, you can go to the allergies and we teach you how to inject it, no? And the family members also. Kasi sometimes, what we do is, it's a vial, you break it, and then you have a syringe, and medyo manual, and then you have to aspirate the right amount, the right dose, and inject it also here, in the upper outer thigh.
Okay. Meron lang akong gustong i-clarify, Doc. So, ang ibang may allergy or allergic reaction, kumakain ng asukal. Sabi kasi ng matatanda, ito yung pang-neutralize. Pang-neutralize ng allergen. Ano po ang take niyo doon?
Well, scientifically, wala talaga siyang basis. It's usually a, how do you call that, folk medicine. If you look at the effect of sugar, there's no antihistaminic effect nor anti-inflammatory. What sometimes it may be helpful if you have hypoglycemia, no? So, or if yung patients who have poisoning, I guess because there's hypoglycemia, but poisoning is not an allergy, no? So, we do not really advise giving the asukal. It's not, hindi naman bawal, but it will not have the same effect as epinephrine.
Okay. Now, Doc, pwede bang uminom na ako ng antihistamine bago kumain ng mga gusto ko?
Yan.
Ayan ang
Natanong yun
common
kanina,
practice
but-
ng marami.
Oo,
But it's
yes.
actually, as I mentioned earlier, playing with fire.
I see.
You do not
because-
know if one day you will anaphylax. So as you keep on taking those allergens, no, some people say, kinain ko ng kinain hanggang na-immune ako.
Okay.
Sabi ko, like
Is
for
it,
example, shrimp.
All right.
Now, shrimp and peanut, they're the ones that don't outgrow.
Okay.
Now, if a patient tells me gumaling sila or nawala yon, my first question is, meron ba talaga silang shrimp allergy to begin with? Baka nangati sila from some other reason, not necessarily shrimp. That's why eventually they were able to take it. No? Now, if you give it little by little, no, and you're not supervised by the doctor, you will be sensitizing yourself. It's like a snowball, no? Yung palaki ng palaki yung reaction. Hanggang one day, parang boom,
So
lalabas
it's
na.
not
Diretso sa-
desensitizing.
Pwede
You
It's
are
sensitizing.
sensitizing.
Alright.
Yes.
Pwedeng dumiretso dun sa severe, Doc.
Yes.
I see.
Now, there are some
So,
processes
there's danger.
abroad where they desensitize orally for
Okay.
peanut, I think, and egg, no? But it has to be done by a specialist at certain levels.
Alright.
So, hindi tayo pwede uwi doon
Self-medicate.
yan. Medyo nakakatakot.
Alright. There are so many questions pa, Doc, that we would like to ask you, but we are lacking time now. Thank you so much, Dr. Recto, for being with us today. You might want to leave some message to our viewers po. Yung pong, mag-iwan tayo ng magandang mensahe para sa ating manonood.
Okay, so allergies are really quite common now, reaching epidemic proportions. Many people have it and sometimes are affected, their quality of life. So we just want to give hope, to patients who have allergies. The allergists are also here to help you determine your allergies and also to give you advice on how to treat them and how to overcome if it's possible. So we just want to say that allergies are not simple. They can be complicated, and what's important is our quality of life is improved.
Again, Dr. Recto is head of the Allergy and Immunology Section, Department of Pediatrics at the Asian Hospital and Medical Center. When we return, more health stories from here and around the globe. Keep it here on Wellness as Well.
Wellness is wealth. That's the richest thing. I can hold myself. Wellness is wealth. That's the richest thing. I can hold myself.
Aside from our physical health, our emotional well-being can also influence how our bodies respond to everyday stressors. But what if we could train the brain to respond more calmly? Today, psychotherapist and trauma specialist Dr. Gina Alfonso discuss one holistic option, a non-invasive therapy called neurofeedback that trains your brain in the same way you train your body.
Do you like your sessions?
Yes.
Why?
Julia, not her real name, wants to prepare her son Michael, also not his real name, for the physical and emotional challenges that come with growing up. That's why she explored neurofeedback to support Michael's brain development and emotional health.
I know that malapit na yung puberty. So I want to prepare his emotions. So nag-research ako. So I think, and I found out na may makaka-help yung neurotherapy.
This is when Julia discovered neurofeedback. Neurofeedback is a holistic approach to brain wellness. Psychotherapist and trauma specialist Dr. Gina Alfonso explains, just as we train our bodies to become stronger, the brain can also be trained to function more efficiently.
Neurofeedback is a non-invasive alternative treatment to therapy to train your brain to essentially function at its optimum. Doing neurofeedback will help you create a new highway, a new neural pathway that teaches you not to be anxious, to approach things in a way that is calmer and more regulated.
Neurofeedback uses real-time data from an EEG or electroencephalogram to train the brain to better regulate its own patterns of electrical activity, helping the brain restore and maintain its natural balance. Dr. Alfonso says a proper evaluation from qualified medical specialist is a must before considering neurofeedback as a complementary therapy.
It's a kind of a multimodal approach to helping that person develop to their fullest.
The session begins with brain mapping, a 1-minute assessment that measures and records the brain's natural activity to assess brain function and connectivity. Small sensors are gently placed into the scalp. The participant then plays a 20-minute specialized interactive game that he or she can choose. Popular categories include pinball, racing, air games, and Pac-Man style game, Michael's Choice. As the game progresses, the system monitors the brain's activity.
We will be training those sites with the help of a computer game. So this computer game po, meron siyang visual and auditory feedback. And this helps in training the brain towards the right performance.
When the brain activity becomes less optimal, the specialized software detects it. The brain learns which patterns are rewarded and repeats them more consistently. The number of sessions is based on the recommendations of the experts. Sessions are held twice a week, each is 20 minutes. After several neurofeedback sessions combined with guidance at home, Julia says her son Michael developed healthier habits and appeared happier.
For interaction naman with people, ngayon, ang approach niya is, "Hi, how are you?"
Dr. Alfonso adds neurofeedback may help promote self-awareness and self-regulation and positively influence overall health, the whole body, and quality of life.
Homes are far more than just physical shelters. They are the baseline environments for our mental, emotional, and physical health. The spaces we inhabit, and the furniture we choose to surround ourselves will play a profound role in shaping our daily well-being. From the alignment of our spines to the clarity of our minds, the quality of our living spaces directly impacts the quality of our lives. Let's watch.
Isn't it nice to come home to a place where all you'll see are things that you have always wanted to have? What more if these are furniture masterpieces that only you have them?
The home, like a home, any home, the furniture has the biggest impact. Kasi yun yung may interaction kay. You sit on a chair, you eat on a table. Most of our projects, their inspiration are from the stories or narratives of our clients. So basically, we just respond kung ano yung need ng client.
This is the core of Genteel Home. You come home and rest on a furniture that you designed yourself or specially designed for you that suits your very style and comfort needs. Katrina shared that pretty things make her happy. That's how she engaged herself in creating these. So from a passion project, Genteel Home became a recognized name in luxury furnishing.
We consider the rub count or kunyari safety naman. Like if you're gonna use it commercial, meron siyang mga fire retardant rating, how many rub counts, of kung may hypoallergenic. Now we have our FiberGuard fabric. Most of our clients are designers and architects, so usually they would know that. Or they will tell us, Kat, I need minimum of 50,000 rub count for this project.
Kat is proud of this particular chair that promotes good posture. It's not just an eye-catching accent piece, but when you sit on it, it straightens your back, make it feel long, yet rested at the same time. Then Katrina walked us through the workshops where her people carefully craft the lovely pieces.
Dinowing niya doon, Gagawa mo ng pattern. Ginawa niya ng pattern. And then, ika-cut niya.
So, ayun na yung upuan.
Yes, ayun siya.
Cute-cute naman.
We maintain Play-Doh in all of our areas.
Today, Gentile Home continues to champion Filipino design by creating furniture that combines artistry, comfort, and quality. It focuses on bespoke craftsmanship, personalized service, and innovative design. The brand remains a leading choice for designers and businesses seeking distinctive furniture that reflects elegance. It is definitely nice to see beautiful things, may it be in your workplace or living space.
The most critical takeaway about allergies is the difference between a minor inconvenience and a medical emergency. You need to know your triggers, trust epinephrine for severe reactions, and never treat throat swelling or sudden dizziness with just an antihistamine.
Stay safe, keep an emergency action plan handy if your loved ones have severe triggers. See you all again next week. Live well,
live wealthy,
wellness is wealth.